In the 1980s, I was not involved, but I was familiar with hospice because of my grandmother and my father. My grandmother earlier and my father later both had hospice services in the 80s. But my real involvement came as a result of the death of my wife's grandfather. He died 5 months before his 100th birthday. And as a result of hospice's end-of-life care, the family requested donations or memorials to hospice. And I considered writing a check, but I thought a better way to express my gratitude was to become a volunteer. I currently make care calls as a volunteer. Once a week I call my team's families to inquire about the patient's health, how they're doing, and then to ask if there are any needs, things they need prior to the weekend. I've heard from hospice team members and from families that this is a very important service to them. They like the contact weekly. I called a lady, I've been calling her for several months, and unfortunately I called the morning that her husband died and we didn't know he died. And so when I inquired about how he was doing, she said, well, he died at 7:30 this morning. And I said, I'm so sorry. And she said, I'm glad you called, I wanted you to know. So, shows an impact and shows that the service is very valuable. Over the years, I've met many wonderful people, volunteers and staff. I just can't say enough about the hospice staff. They're a pleasure to work with. A lot of the things that I learned through my camping experiences, I learned from the staffs. And a lot of personal tragedies I was able to face as a result of those relationships with the professionals that worked here. I enjoy doing things as a volunteer and I like being behind the scenes, but this is truly an honor.